Hi, my name is Sarah Bird. I'm a CSN. This is for speech 3. These are my NARC cards. 1, 2, 3, 4, 5, 6. And this is my audience.
1,
2,
3,
4.
5.
Okay. So I'm here to convince you on why the United States should have national health care. I'd first like to begin off with the United States should have national health care is because it stops people from being in debt to hospital bills. Secondly, the United States should have national health care because it stops the need for illegal medical practices. And then thirdly, the United States should also have national health care because it stops people not being able to afford treatment, from dying because they can't afford treatment. I'd like to start off with how national health care stops people from being in debt to hospital bills. My first evidence is Obamacare. Obamacare is helpful to people who don't have health insurance. From a 2016 article from CQ Research, it states the article addresses how it saved many Americans from being uninsured and stopped many Americans from being uninsured and acted as a free health insurance, as a free health care for low-income families. 15 million people were insured through Medicaid expansions, and so those 15 million people had access to national health care. Medicaid is the closest thing to national health care that we have had in America. People with Medicaid don't have to pay hospital bills because they are fully covered through Medicaid, as I stated. My second evidence is from a 2015 article from Bernie Sanders. Bernie Sanders is a U.S. Vermont senator. This is senator for Vermont. He argued that national health care puts people with the burden of paying copays, and that 50 million people are uninsured in America. So 50 million people can become insured with national health care, such as Medicaid. And they will not be in debt to hospital bills. America will no longer be burdened with those copays and be burdened with the thought of being uninsured. So national health care stops the need. So next, how national health care stops the need for illegal practices. So my article is going to be from 2003 Kipler Personal Finance, and it addresses how medical treatment abroad can be better if you're struggling with healthcare in America. People go to other countries for surgeries and medications as well as procedures because they can't afford it in America. But unfortunately, the treatment done by those people aren't as professional or as experienced like the doctors in America. The article addressed how a woman was floored by the out-of-pocket costs and had to go to Mexico to get fertility treatment, where it was cost half as less for the treatment. So she traveled all the way down to Mexico to get the treatment. And so many people leave America to get treatment abroad, but it can be fixed with national health care. I'd now like to touch on how a New York Times article addressed how people can also save from national health care from dying because they can't afford medical treatment. So I'd like to start off with how people can be safe from national health care because they can't afford medical treatment. So from a New York Times article in 2023, it addressed how Texas was dropping people from Medicaid. This shows that people had Medicaid during COVID because Texas supported those people and allowed them to have Medicaid during COVID. And when the pandemic ended, it stopped insuring those people. And so with the loss of Medicaid, it was the closest the nation had ever been being fully covered. Over half the people in Texas were protected with Medicaid during COVID. But now those people aren't protected anymore, so they're left uninsured. A CBS article regarding people dying from not being able to afford medical treatment is also supporting this claim, because 33% of people from 2014 to 2019 did not even attempt to report that they had issues, like medical issues, because they couldn't afford it. And 27% of those people also responded saying they refuse any medical attention for serious or slightly serious conditions because because they no longer were they weren't able to afford it and they didn't have any insurance. So conditions can arise when patients don't address the medical issues that they have, and so they can further not receive screenings or any follow-up procedures, and the medical condition can worsen. So today I try to convince you on why the United States should have national health care, and why showing you 3 reasons that the United States had national health care, because I showed you 3 reasons why the United States should have national health care, because it stopped people from dying due to not being able to afford medical treatment. It stopped people from going to the need for illegal medical practices, and also it decreases people from being in debt to hospital bills. Thank you.